Hi, my name's Mark Kasabuski. I'm a pharmacist and I'm the provider operations manager with Leafwell. Yeah, so cannabis can definitely interact with some of your medications. Really, what I tell people to look out for anything that's really heavy liver lifting. So if the liver metabolizes a lot of the medications, that's what you would want to watch out for. The other thing, if you are on any psych meds, anything for depression, anti-anxieties, sometimes it can play off the side effects with those as well. Also some of the blood thinners. So it's always great to talk with your doctor or a medical professional just before you do start adding cannabis into your regimen there. So a great resource that I think you could use to learn a little bit more about cannabis, it's Learn with Leafwell, right off Leafwell's website. What that has, it has a great breakdown on the plant. It also will go into all the different studies that have been done and that have been published in different medical journals. So if you did want to dive into it a little bit more, I always think that's a great area that you can use to get a little more information there. So that is possible. I do always urge people at the start, regardless if you're experienced or not, start low, go slow. In terms of not feeling high, what you're going to want to do is really look at the THC level. So you're going to want to keep that as low as possible till you start feeling either the effects, both the high, or if you're getting the therapeutic relief that you're looking for there. I also think mixing things that are in a little bit higher of a ratio, where it is a little more CBD dominant, the CBD can potentially help blunt those high feelings, so to speak, that you might get from the THC. So in terms of knowing how much cannabis to use, you are always going to really want to start low and go slow, especially depending on your tolerance levels, that if you've ever used it in the past, if you have more experience, if you're completely new to it, it is going to be a little bit of a trial and error initially to find out what dose is going to work for you there. Generally, I think 2.5 milligrams is a great starting off point if you're looking for anything that's a consumable, a sublingual, anything like that. You're going to want to wait to see the effects before you consider going up in dose. Yeah, so there's a lot of different options out there for you. If you didn't want to inhale, I generally like to break it down into two different categories, where you have your sublingual routes of absorption and then you have your consumables or edibles, so to speak. So with the sublingual routes of absorption, that's anything that's going to dissolve in the mouth that you put under the tongue. Generally with those products, you're going to feel the effects in about 10 to 15 minutes. They last about 4 to 6 hours. With anything that's consumable, so that's anything you swallow that then the stomach's going to break down, the liver's going to further process it. That's going to take 1 to 2 hours to feel the effects, but then it's going to last 6 to 8 hours. So depending on what you're looking to treat, each cannabinoid is going to have its own therapeutic benefits there. THC, in general, that's the molecule or the cannabinoid that most people do know, where that's going to be the part of the plant that can make you feel the euphoric effects. It's also great for helping out with pain relief, helping induce sleep. That's also the part of the plant that sometimes you can feel the negative side effects, where you can feel a little anxious, a little paranoid, especially if you have a little too much. With CBD is going to be the non-euphoric part of the plant. It's great for helping lower inflammation over time. It can lower anxiety levels. The other thing that CBD can potentially do is blunt those negative side effects that you'll feel from the THC. So it can really lessen the chance that you'll feel the anxiousness, the paranoia, anything like that. So when you're looking at your product label, it is going to vary state to state. That's kind of the biggest thing. I would say in general, when you do go into a dispensary, it's either going to be listed as a percentage. That's going to be for most of the products that you end up inhaling. That percentage is going to be the THC percentage in it. So that's going to be on flower, on vapes. Generally in flower, it's going to range anywhere from 15 to 25%. Sometimes with those higher percentages there, especially if you're THC naive, it's really going to increase the chance that you're feeling the paranoia. With the ratios can also be a little difficult when you go state to state, just because a lot of states will list it THC to CBD, where the THC number is going to be in the front, the CBD number is going to be secondary. Other states will list it CBD to THC. So it's always great to ask the dispensary associate that you're working with, whether it's a patient care specialist, a bud tender, just what's on that label and how to read it. So generally when you're looking at the ratios, it's important to know that that's just comparing one number to another. So that's how, if you're looking at a THC to CBD ratio and it's listed as 1:1, so it's equal parts of THC and CBD. If a product has 2.5 milligrams of THC, 2.5 milligrams of CBD in it, it's going to be listed as a 1:1. If a product has 10 milligrams of THC in it and 10 milligrams of CBD in it, that's still going to be listed as a 1:1, even though that one potentially is going to give you a lot more of the euphoric effects there. So it is always important to really look at not only the ratios, but the milligram content in the product. So I think it's great when you go into a dispensary, always kind of having a few questions that you want to ask. I think it's great if you're able to get your bearings on a menu for what type of product would work for you. I think by having a cannabis consultation before you go into it can be really helpful. That's really going to help you get your bearings just based on how to read a label, what THC and CBD are, what we've seen for different indications. When you do go into a dispensary, I always think talking to the patient care specialist, the bud tender, the pharmacist that are on duty. A lot of dispensaries do have, if you call ahead as a first-time patient, they will allow you to schedule an appointment with someone, where then you can kind of go through the products a little bit more in detail, go through your different indications, your different conditions, and really build out a treatment plan that you think will work for you there. So if it's your first time going to a dispensary, I think it is important to make sure that you're starting low, you're going slow with the product. A lot of times when we hear the negative feedback or negative experiences that patients have, it is because they took a little too much too fast, or maybe they took too high of a milligram content that was good for them. I think it's always important to let the bud tender or the patient care specialist know that you do want to start low and go slow with your dosing. Let them know what you're looking to treat, and usually they're pretty great about recommending a product and pretty knowledgeable. You can always contact us at Leafwell if you do have any further questions, and we're happy to go through things with you as well. Yeah, so a lot of times the strain names can be confusing. I think what's important to know is really what drives a sativa, hybrid, or indica factor in the plant. It's the terpene content in it. So terpenes, they're aromatics that all different fruits and vegetables have. So cannabis has a lot of similar terpenes as certain citrus fruits, black pepper, lavender. And when certain terpenes are present in the plant, let's say if it's really heavy in a lavender scent and it's really linalool's present, that's when it's really going to drive the plant into an indica direction. So I think what's really important, once you start finding a strain that works for you, either ask your dispensary associate, bud tender, patient care specialist what terpenes are present in it, or you can research it online a little bit. Once you start finding out what terpenes are present in strains that are working for you, it's great to keep track of it. And then when you go to the dispensary, you can kind of see what different strains have those terpenes really present, and generally they're going to be a pretty good fit if they've worked well for you in other strains there.